kicking off the meeting in about a minute, just waiting to have a few people join in. I can see a few people are just joining in. So just one more minute. Okay, it's 2:05. So let's kick it. Welcome, everyone. You're welcome to the first part for this year for our capacity building webinar series. Last year, we had the first series, and this year, we'll be having a 4-part series. Before I go, my name is Mikhail Aliu. I work with MSpace, and we are the conveners here in Nigeria. Along with me, I have online our colleagues who you're already used to, and you've already spoken with from time to time. I have Ben, Anya from London School of Medicine and Tropical Hygiene. I have Rebecca and Meredith from University of the Center of Gender and Equity from University of California, San Diego. I have Betsy from FHI and Paul from the University of Makerere, if I'm pronouncing it right. I also have my colleague Hasbi, who you've spoken with most times. Hasbi, unfortunately, has a bit of has lost her voice, so she's here with us, but she might not be speaking so much. But I think she'll be with us throughout the meeting. So not to take so much of the time, welcome once again. For this year, as I mentioned, we'll be having a 4-part series that will cover social norms theory for health promotion. The second part, diagnosing social norms. And the third part, identifying strategies for norm changes. The fourth part will be monitoring, evaluation, and planning. So we're excited to learn and collaborate with everyone here, knowing that everyone has a wealth of experience from their practice. And hopefully we can pull together, and it's going to be sessions of great learning together. So thank you very much. And over to you, Ben.
Thank you very much. So welcome. Well, I just want to add my welcome to Mikhail. Can we just start with a little exercise? So if you're on Zoom, there should be a button that says reactions, if I'm not mistaken. Could you put, and you should be able to like clap, put your thumbs up, put your thumbs down. Could you please put your thumbs up if you have participated in the training, the first training on social norms back from last year? Yeah, is that clear? So you should have a button that says reactions on the lower part of your screen. So Anya has done it. Thank you, Anya. Kolawole, thank you. Is that it? Let's see. Hadiza, thank you. Mariam, Beatrice. Oops, that was too fast, too soon. Okay. Okay, thank you. So this is 1, 2, 3. So this is about half of the people. So I will start with a recap of what was said in the theory section. And Abubakar, thank you. I will start with a recap of a short recap, much faster than what we did last year. But I'll start with a recap just to make sure that the people who haven't been able to participate in the first training don't get too lost in the exercise that we will do today. The way this is going to be structured is that we will have this recap that is going to last about 20-25 minutes. You will have an opportunity to ask questions, and then there will be much more time for you to join into breakout rooms and actually put in practice the theoretical learning that we did last year and I'm about to recap. After the breakout rooms, there will be a small break, and then we will come back and share what has been created in the breakout rooms. I would encourage you to, if you are in the same organization, to join different breakout rooms when the time comes. Okay, so why don't we start? So again, this is the first of 4 practicals. This one will be on what are social norms and what are the social norms that particularly affect the practices that you are interested in. As I mentioned, this is the structure of the day, the recap, a group activity, presentations. You will also see that at the end, we have a small assignment for you. You will get a file that you will be asked to keep throughout the 4 practicals and to complete throughout the 4 practicals. It would be really helpful if you could do that because we believe it's going to be helpful for the work of your organization going forward. Okay, so to begin with, what are social norms? As you know, social norms are unwritten rules of behavior, especially acceptable and appropriate behavior in a given society or in a given group of people. We call that group of people the reference group. More specifically, the reference group is the people that you are thinking about when you want to harmonize your behavior with them. And we will see this in the next slide more in detail. Examples of social norms, you have all discussed them: bring gifts after a travel abroad, offer water to a visitor. There's the example that I like to give often is that when I go to the US, I always need to remember to leave a tip to the waiter. But if you go to Japan, that is actually seen very badly. So social norms change according to the context, and even you can travel across normative spaces. If you go to rural Nigeria, maybe the norms are, or northern Nigeria, maybe some norms are slightly different from southern Nigeria. And these norms are often maintained by positive and negative sanctions, and we will see what these are in a second. Okay, so many schools of thought on social norms. The one that we are using, that is most used in global health, is one that sees social norms as people's beliefs. It's a school of social psychology, the mind, banalization, trivialization, but let's accept it for the time being. Psychology, the mind, sociology, society. So this is how the mind thinks about society. So norms are beliefs that exist in every single person about one, what people in this person's society do. And that is called the descriptive norm, or it's been defined also empirical expectation, with a distinction that we can, between the 2 terms that we can discuss maybe another day. There is a small distinction, but it doesn't matter at this point. And then the second type of belief is what is one person's mind about what other in this person groups approve and disapprove of, or the extent to which they approve and disapprove of something. And this has been called the injunctive norms or normative expectations. Feel free also to raise your hand if you have a question or I am not being clear and you'd like to ask a clarifying question, or feel free to also ask it on the chat. Okay, so social norms can have great positive results, and having shared rules of society can be very helpful, but social norms can also be very harmful. Sorry, someone is obviously trying to reach me. Social norms can also be very harmful. Now, some examples of the harm that social norms can result in is seen across all societies. Very frequently, you might have heard of female genital cutting and child marriage, but the examples of harms also exist in societies all around the world. Like in France in the 18th century, women had to wear corsets that you see on the right-hand side. At the center, you see a man who's lost a hand because of social norms on all platforms. And on the left, you see a social norm quite diffuse everywhere around the world, which is that women should wear high heels, which is bad for the health. Now, just to clarify, I mentioned 2 types of social norms. The first one is descriptive norms, and this is really about what other people do. And when you think about it, you might have heard people saying, well, everyone does it. Or, you know, or when people are trying to convince you, they say, come on, join. Also, all your friends will be there. All your friends are coming to the party. Or this film is being seen by a lot of people. You should really watch this series. Everyone is talking about it. So that's the belief that if everyone does something, well, that something might be good. I don't know if it happens to you, but you might be driving on the motorway and you don't know, that happened to me before. I don't know what the speed limit is. I just look at the speed that others are going to, because, hey, that must be the right speed. The second type of beliefs is the injunctive norms, is really about what is appropriate or not appropriate. And the slight difference, which is interesting, is that in the case of descriptive norms is what most people do, while here is what most people will think about you if you did that thing. And you might be unique, right? So you might be an exception. It might as well be that normally people would approve of people coming to the office wearing a tie, but because, or let me give you an easier example. Normally people would approve of you coming to the office with a wetsuit on. I know it's silly, but stay with me. But in your case, they wouldn't approve because you're the new member of the office, okay? Okay. So of course, these manners do not, what is approved can also be harmful. So that's an example. Well, this is an example that we made before. What is appropriate in a given group can be something that is actually harmful to your health. And this is a group of men. What this man is doing is he's drinking from a beer keg. We also mentioned sanctions. So here's a little guy who is, here's a boy who is who has put on the wrong hat and he's being laughed at. And sanctions are exactly the type of social punishment that you see in this picture. So a negative sanction could be that you're laughed at, that you gossiped about, that you're considered a child. But you can also have positive sanctions. You could be promoted. You could be considered an elder. You could be kept in higher esteem. So the anticipation of sanctions, what I believe will happen if I comply or don't comply with the norm, is what helps keep, one of the things that keep the norm in place. This is one of the last basic points before I recap the key advanced points. A norm is not a personal attitude. And you probably remember this story. The juice of this story is that even though I might want to do something, and my personal preference will be to do something, I can't do that something because of the norm. So that's not to be distinguished. That's not to be distinguished. So I might want to personally, I might hate to smoke, I might hate to drink, but I still do it because of what is, I think people would approve of me. And the story here is the example of the little girl going to the wedding, but I'm sure many of you remember this story pretty well. This is an important key term, and I hope that it's quite clear that just because you comply with an action, that doesn't mean that that's your favorite action, and that doesn't mean that it's necessary what you want to do. I'll expose for a second, see if there are a few questions before moving on to key advanced. Did I hear someone? No? No, okay. So moving on to our recap, some advanced key points. Well, the first one is that some norms exist in a very specific group. So you might have some norms that exist in a neighborhood, in a village. You might have, so when I think about child marriage, which is a practice that I know better than other practices, when I think about child marriage, the practice exists between villages that are in the same marriage network. When I think about female genital cutting, the practice exists within social networks of parents. So these are very specific networks. But the opposite is also true. Some norms exist just out there in the society. So I was learning yesterday when we did a similar seminar that in Uganda, there is a norm that women cannot buy meat at the butcher. And that's true everywhere, right? It's not appropriate for them. It's not because these people, it's not because they know each other very well. It's because it's a norm that is out there in the society. It's not in a group of 10 people, but it's out there in the society. At the same time, the second of 4 key advanced points is that sometimes the norm can be directly related to the practice. And that's the case of female genital cutting, in which you have a practice that is the actual practice of female genital cutting. And you have a norm that as a parent, I will be approved if I get my daughter cut. But in the case of domestic violence, in this case, what we found, for instance, well, this comes from Brazil, no, sorry, from India, is that the practice was domestic violence, but there was no norm that, oh, if I would be approved if I hit my wife, but rather there were a system of norms that contributed to keeping the practice of domestic violence in place, such as women should tolerate violence, neighbors shouldn't interfere in family affairs, and a family should wash their own clothes. The third or fourth point, advanced point, is that it's not all the norms intersect with other factors, institutional factors, material factors, social factors, individual factors that can strengthen or reduce the power of these norms. And then the last point is about gender norms. Gender norms are a specific subset of social norms, and these are social norms that particularly contribute to defining the role of women and men in a given group of society. Very often they also affect the power that women and men have in this group and in this society. Okay, so just to summarize 5 key takeaways. Social norms are beliefs, they're in the mind, they're beliefs about what happens in other people. So they're beliefs about others. They can be descriptive, what others do, they can be injunctive, what others approve of. They exist across different ethnic groups. You might have one of your participants in your intervention who has certain beliefs, complies with certain norms in the capital, but complies with opposite norms in their village of origin. It's not one practice doesn't necessarily have one norm, but norms can different norms can contribute to a practice being in place. Social norms can be the main driver or not, so they can also intersect with other non-normative factors. And some norms specifically contribute to defining men's and women's place in the group, structuring hierarchical relations, and we call those gender norms. Okay, I would like to pause for a second and ask everyone, so is this recap resonating with what you have seen a few months ago? Is this clearer? Is this more confused? And please do speak, because if nobody speaks, we're not going to move along. So I'd like to hear a few opinions about how these has helped or made things clearer or more complicated, what stands out to you, anything really. I'll pause for a little bit. So if I had to pick someone, I wonder if my friends, like if, for instance, Hadiza or Abubakar or Tozin have anything to say about, I know some of you were not in the first meeting, so how is this contributing to your understanding? Do you have any questions? Do you have any comments? But others too, Kolawole, Mariam, Opeyemi, Raihana, Foye, Fatima, Beatrice Elwaka, Dr. Idris, yeah?
And feel free to use the chat box or raise your hand or unmute yourself. Any of those would be great.
This is Beatrice. Hello. Can you hear me?
Yes, we can hear you.
Okay. I think that sometimes silence does not mean that we are not following, but it could anyway. But just to say that the summary is, what we learned from the last experience. And I think it goes well. It's simple enough. It's a reminder for me, so it's good for us. Thank you. Over.
Thank you. Thank you very much, Beatrice, for breaking the norm, for being an agent of change. We had a norm of silence, and Beatrice, you have expanded our imagination, and now maybe we can move into a norm of contribution. Let's see.
Okay.
Hello.
Yes, please. Yeah, Hadiza.
This is Hadiza. So like British said, the presentation resonates with what we learned from the last session, the first sessions, group of sessions, and it just makes things more clearer. And like she said, it's very direct, and it's something we can relate with in our everyday jobs and what we see in the field.
Okay, thank you. Well, okay.
Hello?
Yes, please, yeah.
Good afternoon. My name is Tosin. I want to say this is a very, very interesting session and timely. And I think it's definitely going to speak to a lot of ongoing interventions and projects. And I think for me, one area I feel it will definitely play a major role in the side of gender-based violence. Because as you know, the issue of gender-based violence is increasing by the day. And with the coming of this learning, which has to do with their norms, and we know it's tied to culture and the way of life of people, either they are forced to accept it or they just feel like it's something they should follow. It's a wagon that everybody should follow. I believe it will help to correct a lot of bottlenecks. Thank you very much.
So is there anyone who didn't participate in the first seminar who has questions, maybe? Anything that wasn't clear, something that I could, because we're going now to move on to the practical and the group work, and it's very important that everything I said so far is clear, also to those who didn't participate in the first seminar. So it's really your opportunity to ask questions before you will have to essentially almost explain this to other people. Okay. Okay, well, I've either been very clear or Beatrice, Hadiza, and Tosin didn't manage to change the norm. So, okay. So what we'd like to now, you will be split into breakout groups of about, I think, I was thinking, Meredith, maybe we could stay on the smaller end because we have about 22 participants. So if we do 5 or 6 groups of 5 or 6, that should work. Okay, what we'd like you to do is, well, you will be accompanied in your group by facilitators, but what you will be asked to do is in the group, each of you to briefly starts by describing your work to others and what you're working on. And so your work as an organization, but also to pick one practice of interest that you really, that you'd like to use as a case study. So for instance, if I think about Hadiza and Tosin, they work on education, health, and social inclusion, but they might describe the organization saying, well, this is what we do, this is what we work on, but today we want specifically to use as a case study intimate partner violence, for instance, right? And then once you have decided what practice you want to work on, I would like for you to write on a piece of paper or on your computer, anywhere, to think about 1, 2, or even 3 social norms that you think are affecting your practice of interest. So if I were to move forward with the example that I said about intimate partner violence, and thinking back about the examples that I said in the slide, I will say, okay, the norm is, for instance, respectable women do not speak about what happens in the family with their friends, right? And that's what the norm is. And I'd like for you to write the norm. Then I'd like for you to write the subject. So who is complying with this norm? Who is this norm affecting? And in this case, well, in this case, it's on child marriage. Actually, we could take the example that's written in the slides. It's probably easier. So in the case of the practice here was child marriage, the norm is respectable women marry early. The subject was adolescent girls who reach puberty, because these norms is applied only to adolescent girls who reach puberty, not to adolescent girls who haven't reached puberty yet, okay? Now, what are the sanctions? In this case, the negative sanction. You could also include positive sanction if you wanted. The negative sanction is less desirable marriage prospects at age 18. So that means if you don't comply with the norm, if you don't marry early, once you reach puberty, you will have less desirable marriage prospect at age 18 because people think, oh, there's something wrong with you. And who is the reference group? Well, the reference group is community members. So people care about what other people in their community say. They don't care about what happens in the north of the country. They don't care about what happens in Washington, DC, in Paris, in New Delhi, in Ouagadougou. They care about what other people, members of their community, think. And then you can write down, if your project is in Nigeria as a whole or in a state as a whole, you can say, now this norm is true in the state, but I notice that maybe with this ethnic group is a bit more okay to marry early, with this ethnic group is very strong, or maybe you could say in this neighborhood, in that neighborhood. So you could also take note of any variations that you can think of. Okay, facilitators will be with you, but now I just want to check, is there any questions on what we are asking you to do in the group work, or shall we send you in the group, in the breakout rooms? Okay, well, this was also explained very clearly, obviously. Or so badly that you don't dare to tell me, Ben, this is completely nonsense. So since it seems to be very clear, Meredith, why don't you split us up in the breakout rooms, and then we will make sure the facilitators also are able to coach the group members. Facilitators, if you need this slide, you should have it, but you can also take a screenshot. You should have it already in your email, but you can.
I'll send it.
I had a quick question, which is, did you want the group to, I'm assuming you wanted the group to come together around one practice and brainstorm together about the norms, that sanctions, et cetera, for that practice, as opposed to doing.
Oh, thank you for asking me this. No, I would like for each member to present their case study, and for the group to work with that member. We have an hour, so we have quite a bit of time. 45 minutes to an hour, because an hour including a little break. So if we have, so ideally each practice is a case study for the group to help that participant, that group member come up with this framework.
Great, okay.
And it doesn't have to be one norm. It can be multiple norms for one practice. It depends on what you guys think and come up with, okay? Ideally, you should be able to have about 7 to 10 minutes per person, per group member, to discuss this fully.
Ben, can you just remind us, so when are we coming back?
Yes, good point. So we'd like to come back, take a little break if you need, but it's now 34. We'd like for you to come back at 25. passed.
Okay,
Okay.
got it.
And Meredith will send a reminder when 10 minutes are, we are 10 minutes from the end and 5 minutes from the end. I know.
Yes.
Okay.
All right, if you get kicked out of the meeting and you come back, you should be able to rejoin your rooms as you'd like. So just remember which breakout room you're in. So I will start them now and you'll be automatically sent there.
So this is just a self note to say that I think things in my group went very well. We had 5 participants. We managed to do 4 examples. The 5th participant had connection problems. And someone will now present our results. We're now taking a 5-minute break, but just for the records, this is what we have, so that is saved in the video, and I'll share it later with one of my participants. Great. Hello, everyone. Welcome back. I hope you had a great time in the group, but you didn't spend all of that partying, but you also did some work, okay? I also hope that you had a little bit of time to take a break and that you are ready to start. Okay, I'll just wait a couple of minutes so that we can wait for everyone to come back. Meredith, would you tell me when everyone is back? Do you have a way to know?
I think that everyone is back, but we can just give it like 30 seconds.
Okay. Okay. Okay, here's Tosin.
Okay, I think we're good.
I think we are all back here.
Okay. Okay, thank you, Gibraltar. Okay, so any reflections? How did it go? Was it easy? Was it difficult? Any immediate feedback before we go into seeing what you and discussing what you have produced? But any immediate gut feeling on how difficult or easy this was? What do you think? Was there a part that was more difficult? Was there a part that was easier? Yeah, Tosin, please. I see you unmuted.
Well, what actually?
So it looks like Tosin is
your
having
connection
some
is not.
connection issues. This is Rehana, and we were in the same group with
Yeah.
Tosin. We essentially discussed two aspects. We discussed female genital mutilation as well as
Oh, I don't know what happened. Rehana, can you continue, please?
All right, thanks, Ben. I was saying that we were in the same group with Tosin, and he was going to speak to the female genital mutilation part of our conversation. We discussed two things. We discussed immunization broadly and female genital mutilation. So I can speak to some of the things we discussed on immunization. We were talking about immunization and discussing it both in the context of routine immunization and polio eradication in Nigeria, as well as the new emerging COVID-19 vaccine conversations, and how we're already seeing hesitancy and the way that rumors and social norms may already influence how well the vaccine is received when it does get in country. For routine immunization, there are a number of issues, from women not delivering in the health facility because of social norms that kind of necessitate that women deliver on their own as some form of show of strength, and thus not necessarily receiving the counseling that they would have from antenatal care and postnatal care on receiving on the importance of vaccination for their kids. And then going on to say that where they do deliver by traditional birth attendants, it's a hurdle to get the traditional birth attendants to become immunization champions. And when they do prompt these women to go, a number of things could prevent the woman from going. And typically you would find that a woman doesn't have that agency. So there's social norms that kind of hinder women, especially in the rural parts of northern Nigeria, to not be able to make that decision to get their kids vaccinated without permission from the husbands, and sometimes the husband's brothers or the husband's mother, so mother-in-laws and all of those people that get to be the ones that make the decisions to get the women to get vaccinated. And when they do get vaccinated or do come in contact with healthcare providers, there are also social norms that could impede better follow-ups or better defaulter tracking. So if a woman comes the first time, we may lose her before she completes all of the vaccines for her kids because there's no way to contact her, because most times our healthcare workers are male and they're not able to collect her phone number. Women where, I mean, it's a social norm that a married woman in those parts shouldn't be communing with a man that isn't her husband or a family member, and so may not even be able to give her phone number where she has one, cannot give her phone number to a male health worker to track her, for example, because she's scared that if she calls, there will be conflict in the house if a man calls her phone, for example. So all of those things kind of affect routine immunization as is. And on the other side is COVID vaccine and the role that media, especially social media, is playing on that. You have people believing all kinds of things about the vaccines, about a chip, about 5G, about about saying that the vaccines will alter your DNA and how they're trying to wipe out the African continent, and all of those things that are fast becoming norms or becoming the public opinion on vaccinations, especially for COVID as well, where we're even still struggling to prove to some people that COVID exists. And so all of those things kind of tend to affect how people view vaccinations. And in most cases, the reference groups are the immediate family, mostly men. We have the in-laws, of course, and then we have traditional and religious leaders. And more on the COVID side, we have a lot of religious leaders kind of influencing and contributing to those harmful opinions that are fast becoming norms. And we also see that most times the sanctions are a lot of social ostracization, and in some cases for women, you'd find situations where they might have to face divorce or other forms of domestic violence. Tosin, are you back now? Are you able to speak on the FGM piece?
Hello?
Yes. Hi, Tosin. We can hear you.
Can you hear me?
Yes.
Okay. Sorry, my network has been very, very consistent. Like she earlier mentioned, we had two issues. That one on the FGM, which is the female genital mutilation, is a cutting which we know involves partial or total removal of the external female genital. We know in most cases it causes injuries to the genital organs, and these are done for known medical reasons, and majorly they occur within the age of 0 to 15. We feel this is a very harmful practice that has been on for generations, and it has really has a serious effect on people, especially women, and it has become a norm. More especially, let me use the African context. In so many communities, it's a norm because for you as a woman in that particular community, you are not seen as pure or ready if you are not going through this process. So what people sees around and they believe, okay, it's what has been accepted, are now turned out to be the generation now. So it keeps passing on from one generation to another, and also
I think Tosin, we're still struggling to hear.
That
Tosin, I think we're struggling to hear you. So, and now you dropped off. I think we're struggling to hear a little bit. So if that's okay. And Raihana, thank you very much for the summary. Yes, we're struggling to hear you, Tosin. Maybe we are struggling to hear you. So if that's okay, I will maybe give the opportunity to you to find a place with better internet and maybe move on to another group for the time being. Oh, I think you dropped off, Tosin dropped off. Maybe in the interest of time, instead of waiting for a volunteer, I know Beatrice, you have volunteered in our group and someone else can prepare for the next person. Beatrice, would you like to summarize our conversations? Okay. And I know we have a couple of slides, so let me put those up for you.
Thank you.
Okay. Yeah.
Yes, our group discussed on, we came up with 4 areas of, for our discussion. One of them is the practice of exclusive breastfeeding. We figure the norm is that, mothers who are responsible should give their babies breast milk and additional liquids, including water. This is very important to us because the good practice is to feed the baby exclusively on breast milk only. That's what exclusive means, without adding any other food or drink, not even water, until the baby is 6 months. But the norm is that people must give water. The weather is hot. They have various reasons why the child needs water. Our subject are young mothers who are breastfeeding. Well, not necessarily young mothers, any mothers who are breastfeeding, but majorly the young ones who are just starting. And the sanctions for this practice is that any mother, because the grandmothers are so influential in getting new mothers to give water, any daughter-in-law who refuses to obey the grandmothers are branded as disobedient or thick-headed, not heeding to advice and so on. The reference group that we talked about are the grandmothers and older women in communities. So that's very quickly what we came up with in terms of exclusive breastfeeding practice.
Thank you. Maybe we could take an example. In the interest of time, we could take an example from this second slide. So we have a different topic, yeah, because I want everyone to, if that's okay, Beatrice.
Yes, then we talked about access to essential medicine. And what the norm is that modern responsible people do not patronize herbal medicine because it is primitive. And this is very common among community members who are the subject. And people who patronize herbal medicine are considered to be illiterate, and they are considered to be primitive, and people laugh at them. They become laughing stocks in the communities. And then the reference group that we talked about in this area, health practitioners and religious leaders. The norm is stronger when it comes to variations, stronger among the urban elites than it is in the rural areas. So these are the kinds of the issues that we discussed. I believe we will share the other slides with everyone. And I'm hoping that we have maybe input from other people to enrich what we have presented. Thank you. Over.
Thank you very much, Beatrice. Beautiful. Thank you. I wonder if there is anyone from another group who would also summarize their discussion. Maybe one or two groups. Someone who think maybe you worked on practices that we haven't mentioned yet. Or also someone to just comment on how easy this was, how difficult. Yes, please. Mm-hmm.
Oh, Ben, I was just gonna note that there was only 3 groups. Just so you know.
And we had, we had 3 groups already? Yes. I thought we had 2, no?
No, we only have 2 now.
Just to say that there was 3 total, just so you know.
Okay, so perfect. So if we want to get someone from the 3rd group, then that'd be amazing. So we have had a summary from everyone. I don't know who was in the 3rd group, so not with me and Beatrice, not with Betsy and Raihana. Who was in the 3rd group? Who would like to volunteer?
That would be Rebecca and Anya's group.
I wonder, Rebecca and Anya, if there is anyone from your group that might.
I'm just looking, we have a little bit of some sound challenges. I'm just looking to see who might want to present. Maybe Hadiza?
Oh, I didn't take notes, unfortunately, so I don't know.
Just talk about how the flow of the conversation with it. Yeah.
Okay. So in our group, that's group 2. We started by talked about a variety of norms. We talked about norms centered around sexual violence. We looked at violence in schools. We looked at the issue of having young housemates as and the violence that comes with it. And then we looked at also, let me see. We looked at, sorry, can I see the flow of the questions? It will help me.
Oh yeah, absolutely.
So yeah, so we looked at, so we looked at we tried to put the norms, the social norms into into perspective. That was, it was really interesting because we stated out what it was and then we now put it into perspective. So we looked at a situation whereby girls who go to school are seen as potential victims for violence. So parents would rather keep them at home than allow them to go to school. And then we looked at, in that instance, in some cases, women were looked upon as being the cause of violence being perpetrated upon them, maybe because of the way they dress. So we looked at sanctions also, and that was also looked upon as a sanction, that violence could be also a sanction for a particular norm. And then we looked at the reference groups, looking at community leaders, parents, even peers. And then we looked at the COVID-19, the norm around COVID-19, where people were, who could take if anybody that would take the vaccine would be looked upon as somebody that was being marked by the devil, or was looked upon as somebody whose DNA has been changed, or looked upon as somebody who is perpetrating, fueling the propaganda against the community or Africans, and could be ostracized by the community at large. And then we also looked at reference group, which could be health workers, traditionally, religious leaders, people, community members as a whole. So basically that's, in summary, what we discussed in our group. So we looked at violence and COVID-19.
Thank you. Thank you, Hadiza, very much. Okay, before I show you my last slide, which is the preparation for the next seminar, I'd like to get just guts feelings from everyone. Like, how did this exercise feel? Was it difficult? Was it easy? Is this something that you feel that you will be able to do on your own? How did it feel?
Well, this is Beatrice.
Hello.
Yes, this is Beatrice. I think that initially there was a slight confusion when it comes to phrasing norm. But with the discussion that we have just had and the facilitation, it became more clearer. I think it's something we can all do on our own. I speak for myself. I think I'm able to do that.
Thank you.
Following the discussions we just had, the exercise we just had. Yeah.
Hello.
Thank you.
Thank you, Beatrice. Yeah,
Hello?
Hadiza, please.
Yeah,
Yes.
for me, I think it was really very, very reflective, especially when you're using it in a group. And we're thinking in plenary, because like Beatrice said, there was confusion, but as we began to discuss it more, it became much, much clearer. And with more points coming up, we were looking at other dimensions that we didn't really think there was. So it's very engaging and very revealing also, because even after our discussion, I kept thinking of a lot of other things that could be norms and could be sanctions, and the reference groups. It's very, 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 very interesting.
Hello. In my own take is that we need more practice, more practicals to be able to fine tune what a norm is, who are the subjects, what sanctions, and the reference groups. I think because it's not as easy as it sounds theoretically. Some areas are easier to bring out these 4 parameters, but in some areas we find out that we struggle here and there to be able to come out with it. So I think we need more practice and practicals to fine tune to be able to pinpoint these 4 parameters.
Great, thank you. Anyone else? Any other comments?
Yes. Actually,
Yes,
it's
please. Yeah.
easy and it's also interesting.
Okay, thank you.
Hi Ben. I think
Was
for
that
me
enough?
it was easy. I mean, it was really like just chatting through the different experiences that we had and probing those specific things. I think what
Yeah.
was interesting though for me is trying to figure out what is a norm versus what is things like rumors and perception. So, what is a norm versus what is a perception or opinion that is quite widespread? Because those are things that you find in, in especially in immunization and as well as the FGM example too. Just trying, and then also understanding how things like fears and rumors reinforce norms or vice versa.
Thank you. That's a very good comment. Thank you. Anna. Okay. So I would like now to share a document that will be sent to you, that Meredith will send to you after this work. So this is a little table, we call it a social norms worksheet, that we would like for you to start completing before the next seminar. So before the next seminar, we'd like for you can see my doc, right?
Yes.
I'm not sure I'm sharing the right, yeah, I should be sharing the right thing. So we'd like for you to write here the practice of interest as we did in the seminar. And then we'd like, so you could have one practice of interest, you could have multiple practices of interest, it's up to you, but at least one. So for instance, immunization, child vaccination, exclusive breastfeeding. And then we'd like for you to start writing here the norms, 1, 2, 3, 4, 5, as many as you want, that you think are related to the practice of interest you identified, okay? You will carry this worksheet with you throughout the seminars. And at the end of the next seminar, we will discuss methods to diagnose these norms. Then we'll discuss methods to change these norms. And then with Betsy, you will discuss methods to evaluate and measure this change. So that's the first thing that we ask you. And then, so the first task is, please complete these two columns of this table, okay? One practice, multiple practices is up to you. You can print it. You don't need to send it back to us. This is really for you. Then the other thing that we'd like to ask you to start to think about is, in preparation for the next seminar, start selecting a couple of norms, maybe one that you discussed today and another one, and try to see, without worrying too much, how would you write a vignette to try and collect data on these norms, okay? If you do 2 norms, you will do 2 vignettes. You can find examples of vignettes from the previous webinar, and maybe you will use them. It's not that you will present them like a formal work, but you might discuss them. If you have doubts, questions, you might discuss them in the next practical seminar, where we will be following a structure as similar to the one we did today, with a recap and then group work. So to summarize, we'd like for you to first complete the table that I showed you and the Meredith is going to send you. And then for you to pick 1 or 2 or even 3 norms, as many as you have the time to work on, and start thinking, if I wanted to ask questions about this norm using a vignette, what vignette would I write? The purpose is not for you to write the perfect vignette. The purpose is for you to come, having tried to do this, so that you will have questions on how to do this well. Okay. I wonder, Meredith, if it will be possible to send an email summarizing the task for the next seminar, attaching these slides and attaching the worksheet. Is that something we can do so that people don't need to take notes now?
Yep, definitely. I also wanted to say that Modupe had her hand up, and I think also maybe it was Faiza who had unmuted. So there might be a couple other comments if we have time.
In the chat?
Modupe had her hand up when we were taking questions. Okay, she said no worries. And then I think Faiza had unmuted herself. Not sure if she had any questions to ask at the end here, but I will definitely send out everything.
Okay, great. So thank you, everyone. Thank you to the facilitator for facilitating. Thank you to participants for participating. And thank you to Meredith for making it possible, which are huge work. I think we will see you next time on, what is the date? Is it February? Is it March 9th?
I think it's in the next, I think it's in the next slide.
Oh, sorry. Excellent point. It's on March the 8th, not the 9th. It's on March the 8th when we'll have another practical section, and then we'll have another practical on diagnosing social norms. We'll have the next one on April the 7th on identifying strategies for norms change, and then the closing practical with Betsy, who was here today. Thank you, Betsy, on April 28th on monitoring and evaluation. Brilliant. Well, Meredith, I can only thank everyone and give it back to you for closing remarks.
Thank you. I think we're all good. Maybe Mikhail, if you have anything, otherwise we can wrap up.
No, I think it's all good. It's just to thank everyone for coming in and for the participation. It's been, I'm sure everyone will agree that it's been a good learning process. And I look forward to so much, even more participation for the next session. I think with that, I'd have asked Hasbi to say something, well, because everyone is used to hearing Hasbi's voice. Well, unfortunately, she's unable. Hasbi, you can send a chat so people know you're here. I'm sure everyone is hoping to hear something from you. So perhaps you can send a greeting in the chat. Other than that, I think it's good for my end.
Maybe I just add, this is Rebecca, add one little thing. For any of you who are on this session today, who are part of working groups, the working groups that we're forming, please sort of pay attention to the emails. We're starting to have those first meetings to form the working groups. We're really looking forward to getting together with you and planning out the work there.
Okay, thank you, everyone. Bye.
Thank you.
Bye, everybody. Thank
Bye.
you,
Thank
Thank you.
Bye.
Thanks, everyone.
Thank you, everyone. It was a lovely session. Thank you. See you next month.
Ben. Bye.
Take care of yourself, and I hope your voice comes back before the next tomorrow. I hope you are taking care of it.
I'm trying. Thank you.
Sorry,
Be
sorry, I
careful.
said
Bye.
surprise text there.
Bye, everybody.
Bye.
We miss Cisbia.